Today, the topic which has been chosen is the aneurysms. Now, aneurysms happen to be very important from a medical viewpoint, from a surgical viewpoint, from a viewpoint of nephrology, from a viewpoint of neurology, from a viewpoint of cardiology, as well as angiology. Now, if you go through the questions, many questions have been asked pertaining to the aneurysms. That is why this topic is very important. So we will be dealing with multiple aspects of the aneurysms as far as the subjects I just mentioned are concerned. So basically the first thing is that what is an aneurysm? An aneurysm is a dilatation. So they happen to be dilatation. And dilatation of what? They are dilatations of blood vessels. Now they can be congenital or they can be acquired. So first thing to remember is that the aneurysms are dilatations of the vessels. Now, question asked is the difference between true aneurysm and false aneurysm. So what is a true aneurysm and what is a false aneurysm? Now, if you just have a look at the figure, this is a normal vessel over here. This is a normal vessel. You can see the vessel, the architecture, the peripheral architecture of the vessel is maintained. And over here, there is this outpouching, and this is what is an aneurysm. But over here, there is an outpouching, and all the vessel walls and all the vessel layers have come out. In here also, there is a pouching. But you can see this is a vessel and there's a trauma to the vessel. And over here, this is not a vessel wall which is enclosing or covering the area. So the difference between the true aneurysm and the false aneurysm is that in the true aneurysm, there is an intact arterial wall present on the outside. While as in case of a false aneurysm, what is there? That is also given the name of pseudoaneurysm. There's a defect in the vascular wall leading to an extravascular hematoma that communicates with the intravascular space. So this is the intravascular space over here, and there's a trauma and there is discommunication between the intravascular component and the extravascular component. That is important. Now, pseudoaneurysms. What is the commonest cause of pseudoaneurysm? You have to remember that usually there's a trauma, and once there's a trauma, it can result in a hematoma, a collection of blood, and the hematoma must communicate with the artery. That is what I just showed you over here. This hematoma outside should communicate with the artery over here. So this is very important. Now, pseudoaneurysms differ from true aneurysm in what fact? That they do not contain any vessel wall. As I told you previously over here, this is a true aneurysm and it has got a vessel wall over here, and this is a false aneurysm and it has not got a true vessel wall over here. So that is important. That is why the name pseudo. Pseudo means false. Now, beyond trauma, what are the other causes of pseudoaneurysms? There are certain pathological conditions, and one important pathological condition you have to remember is the Marfan syndrome, and then the second clinical condition is the fibromuscular dysplasia, and number third is the vasculitis, and vasculitis are of different types. Now, first of all, Marfan syndrome. This Marfan syndrome happens to be a darling of the examiners, and you will see many questions in pathology, pediatrics, circulating about Marfan syndrome. So basically, what is this Marfan syndrome? It is an autosomal dominant disease and it is characterized by pathological changes in fibrillin. So that's important. And then it causes many effects in many parts of the body, especially the eyes, the heart, the skeleton, the palate, and the vessels. Now you will be just arguing, so what are the things, what are the components of Marfan syndrome? So I mentioned eyes first. What can happen to the eyes? In the eyes, there can be the dislocation of the lens. About the heart, there can be this classic lesion which is frequently asked, MVP, mitral valve prolapse. In the skeleton, the patient will be tall, unusually tall. Then palate, the palate will be high arched. The arch of the palate will be high. So that's given the name as high arched palate. And what can be the other problems with the vessels? There can be aortic root dilatation. So the root of the big vessel, the great vessel, the aorta, will be dilated and it is prone to rupture sometimes as well. So these are some of the important features of Marfan syndrome. So this Marfan syndrome, because it is a defect in the fibrillin and here in the vessels are also affected. So it can just lead to pseudoaneurysm as well. Now, second thing is fibromuscular dysplasia. And what is this fibromuscular dysplasia? Fibromuscular dysplasia is an angiopathy, a pathological condition of the vessels, wherein the vessels, what happens to the vessels? They get abnormally twisted and swollen. And as a result of abnormal twisting and swelling, the blood flow through the vessel is compromised. There is less of blood flow to the organ it supplies. And this fibromuscular dysplasia is common in many vessels. And it is the commonest in the renal vessels. It is also common in carotids. It is also common in femorals. It is also common in tibial. And it is also common in the peripheral vessels as well. But most important to remember is the renal and the carotids. And what is the important feature? That the vessels have got a typical string of bead appearance. That's important. And then the third, the vasculitis. The vasculitis is a big term. It comprises of many disease entities like the giant cell arterioles or the temporal arterioles, the Wegener's granulomatosis, as well as Henon-Scholin purpura, HSP, as well as Kawasaki's disease and polyarteritis nodosa. So these are the vasculitic diseases. And in the vasculitis, you can be having, in these vasculitis syndromes, you can be having the presence of pseudoaneurysms. Very important. And this is very frequently asked, a high yield targeting point. So Marfan's, what I explained, fibromuscular dysplasia and vasculitis. And what is important is there will be a pulsatile mass. Pulsatile mass will be a fortunate, clinician would be very fortunate to have this pulsatile mass being felt. Now, location of pseudoaneurysms, they, as I mentioned, they can be present along the femoral, even in the heart. The left ventricle can undergo a pseudoaneurysm. Okay, it can pouch out in the form of abdominal aorta and carotid. But mind it over here that these are also sites of true aneurysms as well. So these are the common sites for pseudoaneurysms, but true aneurysms can also occur at these sites. So this is done with a bit of pseudoaneurysm. Now, true aneurysm, which will be having all the vessel components, a true in the truest sense of the word. And over here, what is the shape of the most common type of true aneurysm? It is fusiform. Now over here you can have a look, aorta, and this is a dilatation of the aorta, which is the aneurysm, and this can be a true aneurysm. So this over here, and this is a scan over here. You can see the dilatation over here on the scan over here. So this is again the dilatation of the aorta, a true aneurysm. And in here, this area, this shows an abdominal aortic aneurysm. So this is how you pick up aneurysms. You can see a dilatation, a prominent swelling is there, and there is no doubt about it that it is anything other than a dilatation, as you can have a look. Now, another thing to remember is that the most common site of arterial aneurysm is the infrarenal. It is not the suprarenal, it's the infrarenal part of abdominal aorta. As you can see over here, this is the abdominal aorta over here, and this is over here, this is the kidney, and over here, this is in the renal region. So this is a common site of arterial aneurysm, the infra-abdominal part of aorta. Abdominal aorta. This question has been asked many times. So remember the figure and you will remember this occurrence of aneurysms as far as aorta is concerned. From the peripheral group of aneurysms, there is this popliteal fossa, we have this cubital fossa, the popliteal fossa, and in the popliteal fossa, you have the popliteal artery, and in the popliteal artery, you sometimes get a pulsatile mass which just an examiner, a surgeon, a physician just goes and palpates the popliteal fossa and he feels a pulsatile mass. And the popliteal aneurysm is one of the commonest site of peripheral aneurysms. Among the peripheral, we're not talking about the central. These terms are very specific. Now, one important concern, why are these aneurysms important, is sometimes these can be in the form of dissecting aneurysms. That means the vessel will give way. And once a vessel like as big as abdominal aorta or ascending aorta or any part of the aorta gives way, there's a catastrophe associated with it. There's a large hemorrhage. The blood from this big vessel oozes and the patient can go into a hemorrhagic shock within a span of few minutes. So you have to remember that this aneurysm has got a problem, that once there's a dissection of the vessel, there can be rapid exsanguination of the blood and the patient will go into a hypovolemic hemorrhagic shock, and the recovery from there can be very it cannot recover sometimes, and it can be very fatal, and the patient can just get a spontaneous death because of the rapid blood oozing. So this is over here, you have to remember, ascending aorta. This is the ascending aorta, and sometimes this part can get dissected and it can cause a major catastrophe, as I just mentioned. Now, very special group of aneurysms which we give the name as cursoid aneurysms, and they are specific to an important vessel over here, the superficial temporal artery. You will be dealing with that superficial temporal artery in case of giant cell arterioids, in anatomy as well. But here remember that cursoid aneurysms are something. And what is this cursoid aneurysm? You can see over here, this area especially over here, this is the area of the cursoid aneurysm. You can see CT scan and it has showed the cursoid aneurysm presenting on a scan. This can be asked as an image-based question as well. So what is cursoid aneurysm, pertaining to which vessel? Superficial temporal artery. Now, what is the most common cause of abdominal aneurysms? You have to remember that there is pathological condition of atherosclerosis, the deposition of the lipids inside the vessel wall, and that is a problem which can cause abdominal aneurysms. So over here, this abdominal aorta has been opened, and you can see over here that is the aneurysm, and inside it is the atheroma. Do these aneurysms have any other surgical or clinical significance? Yes, sometimes they can be very fatal, especially once they are present in the region of the brain. In the brain, you have the circle of Willis, which you have read in neuroanatomy. And in the circle of Willis, you have got two components, the anterior circulation and the posterior circulation. And sometimes there can be these vascular dilatations, which we give the name as Berry's aneurysms. And these Berry's aneurysms are sometimes large enough and they can rupture suddenly, and especially in a non-hypertensive patient. In a normotensive patient, a young patient, there can be a sudden onset of the severest headache of the life, and the patient can go rapidly into a stage of coma, and this is what is called a subarachnoid hemorrhage. And subarachnoid hemorrhage is different from intracerebral hemorrhage, because herein, from the subarachnoid hemorrhage, the blood does not go into the substance of the brain. In the subarachnoid hemorrhage, the blood goes into the ventricles of the brain, and this subarachnoid hemorrhage is a result of rupture of Berry's aneurysms. Especially the 70 to 80% of these aneurysms are present in the anterior circulation of the circle of Willis. And this over here, this figure over here shows a vascular dilatation in the circle of Willis. Over here also, this is a Berry's aneurysm, and this is a histopathological view where you can see that this is a dilated part of the vessel which has an outpouching, and this is the aneurysm. Now, there are certain other types of microaneurysms which are important from an ophthalmologist. So ophthalmologist just recognizes these microaneurysms especially in case of diabetes mellitus and hypertension. So hypertension and diabetes mellitus, and this you can see appear as tiny red dots in the retina over here. So these appear as tiny red dots, and these are the microaneurysms which are of significance to an ophthalmologist, and they can indicate the conditions like diabetes mellitus and hypertension. You may be given an image-based question from ophthalmology to recognize microaneurysms. And there is this term mycotic aneurysm. The mycotic over here does not refer to fungus. It refers to the presence of aneurysms as a result of bacterial inflammation. So over here, don't get confused. Mycotic, it refers to bacterial and not fungus. So this is important. Bacterial infections can cause mycotic aneurysms, and they can occur anywhere, because once there's a systemic infection, there is sepsis or septicemia, these mycotic aneurysms can be found widespread in many parts of the body. So over here, this is the mycotic aneurysms in the periphery over here, and this shows the femoral artery. So this is the femoral artery developing a dilatation, a mycotic aneurysm as a result of sepsis. Now, as I mentioned in previously, aortic descending aneurysms, they can be disrupting the aorta due to degeneration of the tunica media. You know that there are various histological layers, media, adventitia, etc., intima. So the media is affected over here, and again the Marfan syndrome and hypertension. They can cause dissection, as I previously mentioned. So these are, so you can see over here the aorta has given way, and this is the dissecting aneurysm of the aorta, which is present over here as well. Now, there's one important clinical condition asked as far as aneurysms over here, and that's again syphilis. Syphilis, how is it associated with aneurysms? Because there can be aneurysms in case of syphilis as well, which we give the name as syphilitic aneurysms, and they usually involve the ascending aorta. Very important. Or they are also given the name as lutic aneurysms. So you have to remember the synonymous term lutic aneurysms concerned with syphilis, as well as the important part of the aorta. It is not the descending, it's not the arch, it is the ascending aorta. So syphilitic aneurysms usually affect the ascending aorta. And what is important, this question has been classically asked many times in FMGE and NEET PG, tree bar calcification. And tree bar calcification is a characteristic feature of syphilis. As you can see, there's the tree, and the tree has got a bark, and this is the tree over here. You recognize it well, and you can see the same appearance in case of the aneurysms of the syphilis. So there will be wrinkling, there will be folding, there will be roughness, there will be irregularity, and it will be just resembling the corrugated appearance as if the mucosa of the interior of the stomach or the bark of the tree. So that is given the name as tree bark appearance. So this is something you have to remember about aneurysms, because aneurysms have got a big role to play. They can be fatal, and the ability of a physician, a surgeon, a pathologist to recognize these aneurysms and for a student to have a basic knowledge of aneurysms is important in extended emergency medicine, as well as cardiology, neurology, nephrology, what we have mentioned. I hope that some of the facts have been cleared, and I wish you best of luck for your examinations. Thanks a lot.